Hello everybody and welcome again to Pretty Noir Health. Today is a continuation on the video I did on bronchiolitis obliterans, which is popcorn lungs, aka the lung disease that's caused by vaping. I've realized that people had a lot of questions about it because apparently some people, especially younger people, think that vaping is safer than smoking. Apparently, it's not. Actually, it is not. It's not safer than smoking. Some of the vaping liquid actually contains more nicotine than regular smoke, like tobacco cigarettes. So it's a lot of misinformation or just not, people just don't know. They think it's cool to vape. It is not cool. It might look cool, but your lungs don't think it's cool, right? It causes vasoconstriction of the bronchioles, which is like the smaller airway passages. I have a picture right here. So the normal bronchiole should look like this. And if you notice in this picture, it is very constricted. Like the opening is way smaller over here compared to the natural, normal, healthy bronchiole. What happens when it narrows like that is that it causes what we call air hunger. You're not able to properly ventilate. So your lungs do not expand as fully as they should, not being able to perfuse like the red blood cells and oxygenate the body because they are struggling. They're very narrow. So people with popcorn lung tend to like wheeze and complain of shortness of breath more so than regular people that don't smoke or don't vape and don't really are not exposed to tobacco products. So what is found in the vaping liquid is called diacetyl. It is also used in as flavoring for certain things like popcorn. I heard it makes the popcorn taste more buttery. So it's not actually butter that's on the popcorn, it's just that chemical. People with popcorn lungs, again, it's seen in younger people because they're the generation that tend to vape more. So then the older people, it does cause in the long run, again, COPD, which is like obstructive disease down the line. And then again, like the focus of my videos is preventative lifestyle. Like I want us to stay away from lifestyle diseases, right? Some of the symptoms that people will report, again, like I said, the wheezing, the shortness of breath, fever, there's night sweats, and also a skin rash that results from vaping. You wouldn't think so. You'd think like, why am I breaking out so much? Why am I having this rash? Why is my eczema always flaring up? It's because you're vaping. Could be because you're vaping, right? It is diagnosed using a chest x-ray and a CT. Also, the treatments that I use to kind of like help the symptoms like the shortness of breath that I talked about and the wheezing is steroids. And like we all know, steroids have their own side effects. There's the weight gain that people tend to have. There's also the risk for diabetes, and also there's nervousness. There's also a trouble sleeping with steroids. Steroids tend to like rev up your heart, like you're just like on an adrenaline rush when you use steroids. Again, what is the treatment for bronchiolitis obliterans, like the popcorn lung, is prevention. My goal is to teach prevention. My goal is to teach us to avoid lifestyle diseases. The only surest thing I can tell you is to quit. If you quit, there's a chance that your lungs can go back to its natural function. Your bronchioles can go back to looking nice and healthy like this picture and move slowly away from this picture. Imagine if your bronchioles look like this by the time you're 16, right? Imagine growing up to 30 and 40 and 50, what would they look like, right? There's also a possibility that it could cause lung cancer. Like I feel like if you know more, the more you know, the better you can prevent yourself from getting a disease that you can prevent. Again, my goal is to teach preventative medicine. It is preventative. What we can prevent, the lifestyle diseases that we can prevent, the more we prevent, the less likely we're going to be ill and the healthier and healthy lives we're going to lead. Again, my name is Pretty Noir Health. You can follow me on Facebook and YouTube, and I have this TikTok account. I have a backup page also, Pretty Noir Health here on TikTok. If you have any questions, the surest way, fastest way to get a response from me is through Facebook. Again, it is Pretty Noir Health on Facebook. Like always, thank you for watching. Don't forget to like, to subscribe, and to share. I truly appreciate your comments. And like always, thank you for watching. Have a good day.